Thank you very much.
The 4 people who tested positive for COVID-19 are part of a larger batch that recently entered into the country.
We took their signs and symptoms, and as a result of that, the health workers or the specialists at Mulago suspected the case, and we took off blood, and it turned out positive in Entebbe. So that is the first case. The second case was actually coming from UK, United Kingdom, came in via Netherlands, and that must have been on KLM, and was currently under quarantine. The third case is a 48-year-old female who also arrived from USA, and as you know, also USA, like UK, was among our Category 1 countries. This one came in via Istanbul and is currently under quarantine. The fourth case was a 55-year-old male who arrived from Afghanistan, and this was a case who was not under quarantine. Actually, we want to clarify this. The earlier release we had said was under quarantine, but that was an error. This was a person who called in and said he was not feeling well.
Dr. Mwebesa says 423 people have been tested so far, and 1,184 are still being followed up.
And the previously identified cases, except the Hoima one, are all in hospital. 10 at Entebbe, and they are stable. The 10 cases at Entebbe Hospital are stable, and they are doing very well, except one who keeps getting fluctuating temperature. I think I mentioned the same yesterday. The temperature is still fluctuating. At one time it is okay, at another time it is down. The case of Ajumani is still in Ajumani and is being managed in Ajumani. And the case of Hoima, as I have told you, we have not brought it back.
Mwebesa re-emphasized that self-tests are not yet possible, and for now the attention is mainly on people who recently traveled from Dubai and those with COVID-19 symptoms.
You report, we take your sample, and we test it for you. We are still discussing with our donors the issue of rapid tests. When we get rapid tests approved by WHO and by other authorities, and we find them validated and correct, then that will make it much easier. We may even allow some private hospitals or other hospitals to do rapid tests.
In an update on the 8-month baby who tested positive, Dr. Mwebesa said it is in good condition. However, the mother tested negative for the disease.
So it is a tricky situation. You cannot leave the baby alone. The baby is still breastfeeding, and the baby has to be with the mother. So we are monitoring and see what happens.
The ministry still urges the public to follow their guidelines in preventing the spread of COVID-19. Walter Mwesije, NTV.